Hello and welcome to the Neurology channel, your go-to destination for all things related to brain health and neuroscience. Today, we're diving into a topic that's incredibly important: the top 10 early signs of Alzheimer's disease. Alzheimer's is a progressive neurological disorder that affects millions worldwide, and early detection is crucial for effective management. So, let's explore the top 10 early signs of Alzheimer's disease. Number 1. Memory loss that disrupts daily life. While occasional forgetfulness is common, especially with aging, it's the persistent and significant memory lapses that raise concern. Individuals experiencing memory loss due to Alzheimer's may forget recently learned information, important dates or events, and even names of close family members or friends. It's more than just misplacing keys or momentarily forgetting a word. These memory lapses interfere with daily activities and responsibilities. In the early stages of Alzheimer's, patients often express frustration and confusion over their memory lapses. They may repeatedly ask the same questions, rely heavily on memory aids like sticky notes or digital reminders, or become increasingly reliant on family members for assistance with tasks they used to manage independently. What distinguishes Alzheimer's-related memory loss is its progressive nature. Over time, these lapses become more frequent and severe, impacting not only short-term memory, but also long-term recollection of significant life events. Number 2. Challenges in planning or solving problems. While occasional difficulty with problem-solving is normal, individuals in the early stages of Alzheimer's may struggle with tasks they once handled with ease. This can manifest in various ways, from having trouble following a familiar recipe or managing finances to finding it increasingly difficult to concentrate on tasks that require sequential steps. In Alzheimer's disease, changes in the brain affect an individual's ability to plan and execute tasks effectively. They may find themselves getting lost in familiar routes while driving or becoming overwhelmed when faced with multiple steps, such as following assembly instructions or organizing their schedule. What's particularly concerning about these challenges is their impact on daily functioning. Simple activities that were once routine may now feel insurmountable, leading to frustration and a sense of loss of independence. Number 3. Difficulty completing familiar tasks. Imagine trying to perform a task you've done countless times before, only to find yourself struggling to remember the steps or feeling unsure about what to do next. For individuals with Alzheimer's, this scenario is all too common. Tasks that were once second nature, such as cooking a meal or playing a familiar game, suddenly become challenging and confusing. Alzheimer's affects the brain's ability to process information and execute tasks efficiently. Patients may have difficulty following familiar routines or sequences, leading to frustration and a loss of confidence in their abilities. These difficulties can manifest in various aspects of daily life. For example, someone may struggle to remember the rules of a favorite card game, or find it challenging to operate household appliances they've used for years. Number 4. Confusion with time or place. Time and place provide the framework for our daily lives, allowing us to navigate through schedules and locations with ease. However, for individuals with Alzheimer's, this sense of orientation can become distorted. Imagine waking up one morning and feeling disoriented, unsure of what day it is or where you are. This confusion can extend beyond the immediate moment, leading to difficulty remembering dates, seasons, or even the current year. In Alzheimer's disease, changes in the brain can disrupt the internal clock, making it challenging for patients to keep track of time. They may become easily disoriented, especially when faced with changes in routine or unfamiliar environments. Similarly, individuals with Alzheimer's may struggle to recognize familiar places or find themselves getting lost in familiar surroundings. For example, they may have difficulty navigating their way home from a familiar location or become confused about their whereabouts, even in places they've visited countless times before. Number 5. Difficulty reading, judging distance, or determining color or contrast. Our ability to perceive and interpret visual information is essential for navigating the world around us. However, in Alzheimer's, this ability can become compromised. Imagine looking at a familiar scene, like a street intersection or a room layout, and finding it difficult to judge distances or understand spatial relationships. Tasks that require visual spatial skills, such as reading maps, driving, or even dressing, can become increasingly challenging. Alzheimer's disease can affect the regions of the brain responsible for processing visual information and coordinating spatial relationships. As a result, patients may have difficulty recognizing objects, faces, or symbols, or they may misinterpret visual cues. This difficulty extends beyond visual perception and can also impact motor coordination and movement. Individuals with Alzheimer's may have trouble with activities that require hand-eye coordination, such as pouring a drink or buttoning a shirt. Number 6. New problems with words and speaking or writing. Communication is fundamental to our daily interactions, but for individuals with Alzheimer's, finding the right words can become increasingly difficult. Imagine having a conversation and suddenly finding yourself unable to recall familiar words or struggling to string together coherent sentences. In Alzheimer's, this difficulty with language can manifest in various ways, from forgetting common words to having trouble following or participating in conversations. Alzheimer's disease can affect language processing areas of the brain, leading to difficulties with word retrieval, understanding speech, and expressing thoughts coherently. Patients may experience frustration and embarrassment as they struggle to communicate effectively. These language difficulties can also extend to writing, with individuals experiencing challenges in spelling, grammar, and sentence structure. Simple tasks like writing a shopping list or composing an email may become increasingly arduous. Number 7. Misplacing things and losing the ability to retrace steps. We've all experienced moments of forgetfulness, such as misplacing keys or forgetting where we left our glasses. However, for individuals with Alzheimer's, this forgetfulness can become more frequent and disruptive. Imagine putting your wallet in a safe place and then struggling to remember where that place is, or finding yourself unable to retrace your steps to locate misplaced items. In Alzheimer's, these memory lapses can occur with increasing frequency, leading to frustration and anxiety. Alzheimer's disease affects the brain's ability to form and retrieve memories, making it challenging for patients to remember where they placed objects or retrace their steps to find them. They may also experience difficulty in organizing their belongings, leading to clutter and confusion. As a result, individuals with Alzheimer's may accuse others of stealing or moving their belongings, further adding to feelings of frustration and confusion. This behavior can be distressing for both the individual affected by Alzheimer's and their caregivers. Number 8. Decreased or poor judgment. Judgment involves the ability to make sound decisions and assess situations accurately. In Alzheimer's, changes in the brain can lead to alterations in judgment that may be noticeable to both the individual and those around them. Imagine a situation where someone with Alzheimer's makes impulsive or irrational decisions, such as giving large sums of money to strangers or neglecting personal hygiene. These lapses in judgment can have serious consequences and may put the individual's safety and well-being at risk. Alzheimer's disease can affect the areas of the brain responsible for executive function, including judgment and decision-making. Patients may demonstrate poor judgment in financial matters, social interactions, or even basic self-care activities. What's particularly challenging about decreased judgment is that it can manifest gradually, making it difficult for both the individual with Alzheimer's and their caregivers to recognize the changes. Family members may notice their loved one making decisions that seem out of character or inappropriate for this situation. Number 9. Withdrawal from work or social activities. Engaging in work, hobbies, and social interactions is vital for maintaining cognitive function and emotional well-being. However, in Alzheimer's, individuals may begin to withdraw from these activities due to various factors. Imagine a person who used to be actively involved in their community suddenly becoming disinterested in social events, volunteer work, or leisure activities. In Alzheimer's, this withdrawal can occur gradually, often as a result of cognitive decline, mood changes, or feelings of confusion and frustration. Alzheimer's disease can impact an individual's sense of identity and confidence, leading to a loss of interest in activities they once enjoyed. They may also experience anxiety or embarrassment about their cognitive difficulties, which can further contribute to social withdrawal. Additionally, changes in behavior and personality, such as increased irritability or apathy, may also influence an individual's willingness to participate in social or occupational activities. Family members and caregivers may notice their loved one becoming more isolated and disengaged over time. Number 10. Changes in mood and personality. Our mood and personality traits are integral aspects of who we are, shaping how we interact with others and experience the world. However, in Alzheimer's, these aspects of a person's identity can undergo significant alterations. Imagine a loved one who was once cheerful and outgoing, suddenly becoming irritable, anxious, or withdrawn. In Alzheimer's, changes in the brain can lead to shifts in mood, personality, and behavior that may be distressing for both the individual and those around them. Alzheimer's disease can affect the brain regions responsible for regulating emotions, leading to mood swings, irritability, and apathy. Individuals may also experience changes in personality traits, such as becoming more suspicious, socially withdrawn, or exhibiting impulsive behaviors. These changes can manifest in various ways, from increased agitation or aggression in response to minor frustrations to a loss of interest in activities they once enjoyed. Family members and caregivers may find it challenging to cope with these changes and may struggle to understand and support their loved one. If you or a loved one are experiencing any of these signs, it's essential to seek medical advice promptly. Early diagnosis allows for the best possible treatment and care planning. Remember, while these signs can be early indicators of Alzheimer's, they can also be caused by other conditions. Only a healthcare professional can provide an accurate diagnosis. Thank you for joining us on the Neurology channel. Don't forget to like, share, and subscribe for more valuable insights into brain health. Until next time, take care.